Hello, everyone, and welcome to another episode of Motivational Mondays. Today, we have a very inspiring guest with us, Dr. Ron Anbar. And Dr. Anbar is a board-certified pediatric pulmonologist and the founder of CenterPoint Medicine, where he helps children and teens unlock their full potential through counseling and hypnosis. He's also the author of Changing Children's Lives with Hypnosis, a journey to the center, and a regular contributor to Psychology Today online, which I read very often. And Dr. Anbar is passionate about making mental health care more accessible, especially helping young people managing stress and improving their sleep, building healthier, happier lives all around. So we're thrilled to have him here today on the show. Please welcome Dr. Anbar. Hello.
Thank you so much for having me. Hello.
Yes, sir. It's my pleasure. And we were talking a little bit before we began recording, and I mentioned to you that it seems like it's a really difficult time more than past generations, perhaps, for today's teens to sort of cope on a day-to-day basis. Is that a perspective that you share?
Absolutely. I'll tell you the reason I think is because of social media and the internet. It's caused so many difficulties. Let me just name a couple of them. First, it's people spend a lot of time looking at social media and texting, and this takes time away from other things that might be healthier for them. Secondly, they spend all day and night texting and socializing, so this disrupts their sleep. And lack of sleep leads to things like anxiety and depression and lack of motivation. And thirdly, they see on social media things that aren't necessarily real, so they'll see the best of other people's lives, and they say, what's wrong with my life? And the last thing social media does is it spreads the news very well. Sometimes it's misnews, but it's news. So, for example, if there's a school shooting somewhere, everybody hears it everywhere, and it seems like in your face. I researched school shootings as an example a while back, and there were school shootings back in the 70s and 80s, but nobody ever heard about them. Unless you watched the evening news, you didn't know about it. Now kids are faced with it, and so their anxiety rises, understandably.
Yeah. Well, and I'll say that even not just kids in that case, because everything you just mentioned, I think I check all those boxes too. I'm far from my teenage years, but yes, my partner will tell me I spend way too much time on the phone, on the internet, arguing with people over political perspectives, who I'll never meet probably. And of course, comparing myself to things I see online and wondering, why don't I have those things, without realizing and remembering that so much of that is manipulation and false. And it can
Correct.
really like kind of lead you down a path of trying to chase something that's not even real.
Right, but as an adult, you already have an identity. You know who you are. As a teen, you're trying to figure out who you are, and you do that by looking at others, and then it gets very confusing.
Yeah, and we've been seeing there's I think HBO did a really wonderful film where they took like 10 unknown people and just all through like fraudulence, and like they rented yachts and they put them on airplanes to like the Maldives, and like they faked these personas of these people who had no personas really at all. And like by the end of a month, they had like millions of followers, and it was all fake, So yeah, so everyone listening, please keep that in mind, that what you see on social media is not always the real deal. But can you share what first inspired you, though, doctor, to specialize in the pediatric pulmonology area and hypnosis therapy?
Well, two different answers. Pulmonology, when I was a teenager myself, I volunteered at the Children's Hospital of Stanford and befriended a young man with cystic fibrosis, which is a disease you're born with. In the old days, it would chew up your lungs and people would die in their late teens. And now, thanks to new therapies, people living into their 60s and 70s, which is very exciting to see. But I went into pulmonary medicine to help people with cystic fibrosis. That was my main drive. And then after practicing pulmonology for a good 15 years, I ran into a young man with bad food allergies and asthma. And he told me when he smelled cheeseburgers, he developed asthma attacks, which is a rather strange complaint. I thought to myself, maybe a milk molecule is going through the air and attacking him, but that, by the way, is not true. I asked him if he could imagine eating a cheeseburger, which he could not do in real life. He closed his eyes, and within seconds, he had a terrible trouble breathing. And I thought, oh no, he's going to have anaphylaxis, going to have a terrible allergic reaction. So I told him to stop it, and he did. And I said, "You're kidding me." And he said, "No, I couldn't breathe. That was my asthma." I said, "Whoa, if you can think your way into illness, can you think your way out?"
Hmm.
And the answer is yes. And he actually worked with me for a good year. We practiced all sorts of hypnotic things because what he did was a form of hypnosis. He used his imagination to affect himself. That's what hypnosis is. And I learned more about it. And it worked so well, I started teaching other kids with lung problems like coughing or shortness of breath. And then I expanded my practice to all of pediatrics, so kids with stomach aches or headaches or bedwetting or anxiety or depression. And it was so much fun to help kids help themselves that a decade ago, when I left my job at the university in upstate New York, I opened up a private practice, and this is what I do full time as I teach kids how to use hypnosis to help themselves.
Okay, so I have to tell you, I that was fascinating to hear, but I'm thinking like, there's a balance, right? Of when there's an actual physical thing happening and when it's just maybe something that's like a mental thing to overcome. So how do you make that distinction between the two?
Very good question. So, first of all, you want to work with a health professional who knows what they're doing. So, you don't want to just go try hypnosis for everything with somebody who doesn't know how to treat your condition
Mm,
without um, without hypnosis.
right.
However, let me tell you this: every person with a chronic health issue, and that's 60% of Americans, by the way, every person can benefit from learning how to regulate their emotions, how to do hypnosis. Why? Because psychology is always involved. The mind and body are not separate. So even if you have an illness like cancer or chronic inflammatory bowel disease or rheumatoid arthritis, these are real physical illnesses. There's a psychological component because you might be anxious because you have the illness. So you might be getting depressed or you might
Mm.
give up on your life. Those are all psychological. And your psychology then makes your symptoms worse or better. So when you learn how to do hypnosis, you learn how to um, change your symptoms. And sometimes it's dramatic. And what's even weirder is that sometimes a physical illness starts symptoms. The physical illness goes away, but the symptoms can remain for years. Irritable bowel syndrome is an example of that. I took care of a young man who had stomach ache, stomach problems for 13 years from the age of 3 to the age of 16. And he'd been through the rigmarole. He'd been multiple tests, multiple medications. His life was a mess. He couldn't even get to school in the morning because he was having bowel problems. He couldn't go to after school sports because he had to go home and use the restroom.
Mm.
3 weeks after you learned to do self-regulation with hypnosis. And by the way, my new book, The Life Guide for Teens, has lots of tools, self-regulation tools. Even if you don't do hypnosis, you can regulate yourself. 3 weeks after doing that, his symptoms were 95% better. He could resume a normal life. And I know it worked for the next 25 years because I checked with him
Hmm.
when I published his story in Changing Children's Lives with Hypnosis. I wanted to ask his permission. He said yes, and he's still well.
Well, that's fascinating too, because I think what you're proposing is a mind shift on how we think of hypnosis. Because quite honestly, when we hear the word, we think of like some like guy with like a metronome or a locket, swinging back and forth
Correct.
and spiral eyes, like some Vincent Price movie.
Correct.
With all the little bizarre sort of like things we think about. But you're not like saying it's a cure necessarily, but you are saying it's almost like it's a coping mechanism for managing your emotions, as you called it, which then sort of works in conjunction with if you have an actual physical illness, just regulating how you're processing it, how you're handling it.
Correct. So again, to clarify about hypnosis, it's not mind control. It's not sleep. It's something you do for yourself, and it's not unusual. We all do hypnosis all the time. Have you ever gone 3 miles down the road and said, "How have I gotten here?"
Yeah. Yes.
That's
Yeah.
hypnosis. Have you ever been in a boring lecture and started daydreaming? That's hypnosis. So hypnosis is a normal state of mind, but when you're in that state of mind, you're more receptive to suggestions from yourself or from others. I tell the kids, hypnosis is using your imagination to help yourself.
Hmm.
Now, you're right that people have misconceptions about hypnosis. And with my first book, not enough people read it. I had I've had over a couple of thousand readers, but I think one of the things that prevented more people from looking at it is the word hypnosis. So my
Mm,
second book, The Life Guide for Teens, I don't mention hypnosis on the cover, although we do talk about it to some degree in the book, because what I want teens to understand is that they have the power to help themselves. They don't have to wait for somebody else to help them. And this is not just with disease. If you're an athlete and you want to become a better athlete, or if you're a student and want to become a better student, you have the power inside you to excel at those fields. And I'll tell you this, Corey, every top athlete uses hypnosis, whether they call it hypnosis or not. They use their mind. Every top athlete, Michael Phelps, the swimmer, says he's rehearsed swimming hundreds of times in his mind so he knows exactly what to do when he goes out swimming.
hmm
Michael Jordan used hypnosis. Phil Jackson, the legendary coach of the Bulls and the Lakers, he taught mindfulness and hypnosis to his players. And the reason every top athlete uses this, if they did not use their mind this way, they would not be top athletes. That's what makes them excel. Steph Curry is not the biggest or strongest basketball player out there, but he's the best three-point shooter the NBA has ever seen. It's because of his mind.
Mm. Yeah, I have to say, I interviewed a few Olympic athletes on the show. One of my favorites from when I was a child and was a big fan was Greg Louganis. And you're right, he didn't talk about hypnosis, but a lot of what you just mentioned when he told me about how he began like at 2 years old, this sort of focused vision on what he even looks like when he's in the air, rotating into certain flips and all that. It's programmed and he focuses on it with like a laser beam. And it's almost like another state of mind for him where he's like, I didn't come to the Olympics to get the silver. I've been focused on that gold medal since I was a child. So that's what I came to get. Interesting. And I think we can apply that then obviously to other aspects of life. We're not all going to be star athletes, but you're saying we can apply that to perhaps academia. If you want to be a better, maybe husband or wife, or I mean, I guess every aspect of life, you can apply this.
Correct. And it's not a matter of being a star athlete. It's being the best you can be.
Hmm.
And people can be better than they believe. In fact, belief is so important. If you believe you can improve, you do. If you believe you can't, if you believe this is it, that becomes your reality. One of the things I talk about in the Life Guide for Teens is how we talk to ourselves. For example, if you say, I can't do something, your brain hears it. Okay, you can't do it.
Hmm.
If you say, I want to do it, your brain says, okay, how am I going to get you there?
Hmm.
This is not a new topic, by the way. Henry Ford, the automobile manufacturer, he said 100 years ago, whether you think you can or think you can't, you're right.
Yeah, that's great. Yeah.
What you believe is what you say. And in fact, Buddha, 2,700 years ago, he said, what we think is what we become. So
Hmm.
true. And you can do this starting today.
I hear that very often. Like people, they decide that, they are living for other people, their parents or their people at church or whomever, right? The most negative voices are the ones that are in our heads, but they're not always our own, wouldn't you say?
And that is correct. And so important point you made. One of the things I talk about in the very first chapter of the Life Guide with Teens is we need to be careful of the words we use for ourselves. And as parents, we have to be careful about the words we use with our children. So if a parent might get really angry at their child and said, you're never going to amount to much, you're
Mm.
lazy, you're a loser, the child takes that and incorporates it. So that's one thing. The other good thing to understand is that the child can block this. I teach kids how to block negative input. So when a coach says to them, you're a terrible player, the child learns to block it by saying to themselves, I can be better. I want to be better. I'm a good player. I'm a good teammate. And by saying that, they prevent the negative effect of somebody's poor input.
Mm. And since we're on that topic again, obviously of young people, you did mention early on that sleep is an issue. People think that older people are more the ones who need sleep, but young people are also sleep deprived, I would guess is the term. So what are some ways other than, putting down social media? What are some other ways that teens can improve their quality of sleep?
Well, first of all, I got to convince them it's important. And it's so important because teens can get away with not sleeping much and just be tired all the time.
Yeah.
But when you're tired all the time, you're not thinking straight. You're not doing as well in school. You're more likely to get anxious. you're more likely to get tired and not be able to problem solve. So you might be more at risk of using a drug as a way of dealing with things. So, and when you sleep is when you grow. That's when people get taller. When you sleep is when your immune system regenerates itself. So you're less prone to get infections. One of my patients said, when you sleep, it's like when the school janitor comes at the end of the day and cleans out the school. That's what happens when you sleep. The janitor comes in and cleans your brain. So sleep is so important for teens. Now, teens need more sleep than adults because they're growing. So a teen might need between 8 and 10 hours of sleep at night. And how do you know if you're sleeping enough? In the mornings, are you awake? Do you feel awake or are you tired? You have to be dragged out of bed. If you need to be dragged out of bed, you're not sleeping enough. So you can actually figure out how much sleep you need by that way. Or you find out if on weekends you're sleeping until noon, but on weekdays you wake up at 6 to get to school. You can sort of figure out how much total time of sleep you get in a week by adding up what you sleep on weekdays and weekends and divide it by 7. That way you'll know how many hours you need to sleep every night. Now, besides putting on social media, things to help sleep include having a regular schedule. When you go to bed at 10 o'clock on weeknights and 2 o'clock in the morning on weekends, your body gets confused. So you want to sleep the same way each day. You want to use your bed just for sleep, not for homework or talking on the phone. You want your body to associate bed with sleep. You want to avoid caffeinated beverages. You want to avoid exercising late at night if possible. You want to be outside in the daytime because exposure to the sun sets your hormone cycle well. So by the time you get to nighttime, your hormones are ready to help you fall asleep. Those are some of my other methods that don't involve hypnosis per se, but you can use hypnosis to fall asleep by imagining yourself falling asleep, or imagine drinking a sleeping potion, or you could imagine a dial that you can control. If you turn it one way, you get drowsy. If you turn it the other way, you become awake. So those are some imaginary things you could do to help yourself fall asleep as well.
One of the most difficult things, too, of being a young person, as we all probably have experienced, many of us, relationships in general, whether they be romantic or friendships or whatever. But when it comes to, I guess, sort of like I would say romantic relationships, like their first one, navigating that, it's a very difficult time. So how can you think teenagers recognize when it's sort of like a healthy situation or they should remove themselves from it?
So first of all, you want to be ready to have a romantic relationship. And to be ready, number one is you want to have an identity of yourself. You want to have an idea what you like and what you want, as opposed to follow the crowd. So a lot of teens, I feel, they feel pressured to get into a relationship because they see their friends getting into the relationship. That's not a good reason. So fear of missing out is a bad reason to get into a relationship. So, but if you're mature and you feel like you want to share your life with someone and you feel like you want to help somebody else or be a friend to somebody else in a romantic way, that's a good sign that you're ready for a relationship. Don't go into a relationship because you want something. You feel lonely and you think it'll fill your needs. The relationship is not about taking, a good relationship is not about taking from somebody else, but it's wanting to give to the other person. So that's a couple of clues. So you want to be ready. And we talk about this at length in my book. And then once you're ready, there are red flags that you might want to watch out for. First of all, you and your partner, you should be able to talk openly to them about what's important to you in life. So if one of you is into smoking and loud music and the other one is not, that's probably not going to go well together. Don't change important things for yourself because of the relationship. That only creates problems, because if it's important and you suppress it, it's going to come out as a problem later on. Make sure you and your partner agree on what nature of the relationship is. Is this just you're going to get together for a few months and be friends, or one of you wants to be lifelong companions of each other, the other is not ready? If you're not on the same page, don't move forward into relationship. And sexuality comes into this as well. A good relationship, sexuality is not the leading thing for it. It comes along with it once you've known somebody really well. Having sexual interactions before both people are really ready just leads to heartache and more
Mm,
complications. So a good way of getting to a good relationship is to be friends first, and then move into, hey, I really want to be with that person most of the time,
hmm.
and that's a clue that it's a good relationship.
Yeah. No, that's great advice. And speaking of advice in general, this is kind of an interesting perspective when you talk about like the teen to teen perspective, if you will. Um, your book includes sort of like insights, firsthand insights from teens, by teens, for teens, from teens to other teens in that regard. Um, in my mind, advice from someone who doesn't know anything more than you is not necessarily the most beneficial advice. So why do you think teen to teen perspective is important versus teen to someone who's older and uh, more learned, as my grandmother would say, in life?
Well, I think we all need to be humbled. So I know a lot of stuff. I've talked to 8,000 teens over the years, or not just teens, but also young adults. But I'm not a teen, and I haven't been one for a few years. Um, I didn't grow up with the internet. I didn't grow up with the social pressures these teens are under. So the
Mm-hmm.
teens can give a perspective that I might not have. So I think asking teens for their input and the selections that I put into the book, I thought added to what I was saying, or sometimes in ways I hadn't even considered. So a book is never complete. I could work another 10 years, for example, add your hypnosis suggestion for insomnia. But I think when I present information, I want to give it as broad a base as possible, and involving the teens was really important. I will also tell you this book, The Life Guide for Teens, was teen tested. Every chapter was probably read by 20 of my patients, my teen patients. So I got feedback, does this make sense? Or doesn't make sense? So I think it's a work of many people. I acknowledge like over 50 teens in the
Mm,
book who helped create it.
mm,
So I'll tell you, another feature of the book is a section for parents. So each
yes.
chapter is structured with information about whatever we're talking about, be it anxiety or sleep or relationships. Then there's 5 to 10 tools that you can start using today to help with that issue. Then there's a teen to
Mm-hmm.
teen section you mentioned, and then there's a page for parents, which I mean for the teens to read as well, so they'll know what the parents are being taught. But for example, one of the big messages to parents is let your child navigate their own life.
Mm,
It's not your job to rescue them, um, because and failure or not succeeding is an important part of growing up. I heard of a new term recently. You know, the helicopter parent term. That's the parent who micromanages their child and tells them what to do. And then there's a bulldozer parent. That's the parent
hmm.
who clears the path before the child even gets there, so they face no obstacles.
Mm,
How horrible! Because if the child doesn't face obstacles, they have no idea how to deal with obstacles. And
mm-hmm.
life, throws many challenges. So as a parent, I teach parents, please let your teen make their own decisions. And if they have to make mistakes, let them make mistakes. Be there to support them when you're asked to help. And the only time a parent should intervene, in my opinion, especially with later teens, is if it's a life or death situation. Then they have to say, no, this isn't right. But sort of that, if they don't want to study, they want to get Fs, you can tell them why that's not a good idea, but let them live that life.
Yeah, that's great advice. And I love that, the idea about letting parents sort of like, well, encouraging parents take a step back. I think a couple of generations ago, not even generations ago, I'll say well, maybe if we go to, and this is not to bash in any way, to bash Gen Z, but I did notice that there is this sort of like different kind of kid that grows up in the everybody gets a trophy society, a participation trophy just for showing up. And I really have to say I've spoken out against that philosophy. I appreciate what that intended to do, but in real life, you don't get a participation trophy for showing up. Life is unfair. And if you start kids off with this idea that they're going to be rewarded just for showing up, it's a real false premise. It's just, and I don't know, I think that does more of a disservice than help a child. So what's your thought on that?
I fully agree, because life, you don't get trophies. And we know that employers are really complaining that young employees are not good because they expect to be coddled expect
Mhm.
to be helped, expect to be told what to do, and
Yeah.
expect to really be micromanaged. And that's not what the real world is like. The real world is you need a teenager or an employee who is a self-starter, who believes in themselves, who's willing to go the extra mile. That's the ideal employee. And many teens, Gen Z teens or whatever generation we're talking about, aren't prepared to do that.
Yeah, I have a good friend who's a taekwondo coach, and he started teaching young kids. And he said, like the second week he did it, like 10 parents showed up, and they said, the crash mat is too thin when my kid is being flipped over or whatever the situation. And so like the next week he had to put like a stack of like 10 mats, and he just told the parents, well, I'm going to do this for you. But the point of your kid landing on a hard mat is as close as it will be to the ground if your kid is ever in an actual confrontation in the street. But sure, we'll put your kid on this like 25-foot padded mat because it'll make you feel, safer. But that's not real life. So I want people to really understand what we're saying here. We're not being, I guess, tough guys, but we're just saying like life is tough. You have to be sort of conditioned for it for the longevity of success.
I want to tell a story. When I was 13 years old in gym class, there was a rule that you weren't allowed to cross a line after gym to go to your next class until the bell rang. So one day came and the bell was about to ring in 3 seconds. I saw a friend. I crossed the line. Gym teacher caught me and said, "That was really bad. You broke the rule. You have to run laps at lunchtime." I said, I think that's too much. He said, "Well, pick up litter at lunchtime."
Mm.
"No, that's not right." I said, it wasn't that big of a deal. I went home and told my father what I had done. So what do you think he said? He said, "You are really wrong to disrespect your teacher. How dare you?" He wrote a letter of apology, which he made me take to the teacher to give him the next day, which was quite embarrassing.
Mm.
The teacher said, "Don't do that again." And I didn't. And actually,
Mhm.
from then on, I got straight A's in gym for the next 4 years. And I was
Yeah.
getting B's. My attitude changed. Imagine how it worked today. "Oh, what a nasty teacher you have. We should write to the school board." And the child would be empowered to
Mm.
do bad things. We
Yeah.
need to go back to telling, if you're a student, you need to respect your teachers, respect your elders. We need to come back to that.
Mm. Well said, sir, and I do agree. And like I said, and I like you stressed the point. We're not really even sort of like targeting any generation at this point. We're just saying if that is the parenting style you have, you might want to reconsider it. No matter what generation you're in, kids should be raised with more accountability. So that's the moral of the story. I've got two more questions for you here today,
Yes,
doctor.
sir.
Yes, yes. Well, one is finding the meaning in life, that whole, very sort of, I guess, gray area, if you will. So how does having a sense of purpose improve mental health? And what advice do you have for teens who are trying to figure that out in their young lives?
Great question. So, sense of purpose is so critical to having a good life because it puts things in perspective. So, for a teenager, if I have a purpose, and we'll talk about how to develop a purpose in a moment, then when I come to a hardship, I'm going to work through this because I have a purpose. I need to get through this hardship to get to my purpose. If life is purposeless, so why should I even fight the purpose?
Mm.
Why should I fight the challenge? Because there's no meaning to it. At the end of life, by the way, or when you're older, sense of purpose is so important. People who don't have a sense of purpose die young or younger.
Mm.
So many people, they retire and then they die because they have no purpose anymore. So I'm talking to your older listeners. Uh, Purpose is important. Now, you're correct. Teenagers, they're just trying to figure themselves out. And what am I supposed to do? And you can't answer that straight off. This is something you develop over life. But what a teen can do is, first of all, maybe find some spirituality in their life. And I want to talk briefly about that. And if they feel spiritual, if they feel like there's something greater to life than what we're seeing in front of us, then you can think to yourself, well, there is a purpose. I just have to find it. And it's not even one purpose, it's a purpose. So a purpose teens can practice right away is acting kind to one another, be helpful to other people. That's a purpose. And that's something people and a lot of teens get into at a young age. Go work at a soup kitchen. Give a homeless person some money. Help somebody shovel snow if you live in that part of the country. So that's sense of purpose. I mentioned spirituality, so let me just talk a little bit about that. Spirituality does not mean religion. If you're religious, cool, that you can find God or whoever your religious leader is. But if you're not religious, you can find still spirituality by going out in nature, looking at awesome things that nature has created, or look at an amazing painting that was drawn in fine detail, or go to an amazing museum. That's a way of getting spiritual. I also teach kids, and I talk about this in my book, how to talk to their own subconscious. And the subconscious, that's the part of your mind you're not always aware of, tends to be wiser and smarter than you. So by accessing that part of yourself, you realize, hey, there's part of me that kind of gets it, things I don't quite get. Part of me knows it, and that's a very spiritual experience. And then you realize, there is more to life than meets the eye.
That's wonderful. And listen, we'll just advise everyone out there, if you have a passion in life you want, especially young people, hey, keep going. So just keep going and try it out. Now, I do, doctor, want to clarify your book. So your first book, as you mentioned, was that your first book, Changing Children's Lives with Hypnosis?
Correct.
Okay. And that was called Changing Children's Lives with Hypnosis, A Journey to the Center. But then your current book is
The Life Guide for Teens.
The Life Guide for Teens. Yes.
It has a longer title, but it's hard for me to keep in mind, so we'll just stick with that.
Yes. Well, we'll make sure that there are links to both books there so that people can check them out, because it's really wonderful information. And I just want to say thank you so much today, Dr. Ron Anbar, for being here today. For being here today with us. And you are just a plethora of knowledge, not just for teens, but for all of us to live better and do better. Board certified pediatric pulmonologist and the founder of CenterPoint Medicine and author. Thanks so much for being here today on Motivational Mondays.
It's my pleasure. Thank you for having me.